Schizophrenia is a very serious mental illness that most people have heard about before. Maybe you've read about it in books or seen movies or a show on TV, but you're probably familiar with the term. And because of this familiarity, I think that people sometimes try to learn about schizophrenia through the lens of the information that they've come across before. And I want to warn you against that, because the way that pop culture talks about schizophrenia is very different from how psychologists talk about it. To start off this conversation, let's talk about what schizophrenia actually means, and it basically translates to split brain. But when we say this, we're not referring to multiple personality disorder or anything like that, because that's actually a very different disorder. But instead, when we talk about a split brain, we're talking about a split from reality. And I think that this split is nicely summarized in the symptoms of schizophrenia. And those include disorganized thinking, hallucinations, which are incoherent and often disturbing perceptions. And then there's also different emotional responses that are typically deemed to be inappropriate. And when we are talking about this cluster of symptoms, we find that they all fall under the umbrella term of psychosis. And we use this term to describe any psychological state or disorder where a person loses contact with reality, usually in terms of ideas and perceptions. So let's go through these different symptoms, and we'll start with disorganized thinking. And when we're talking about disorganized thinking, we're talking about thinking that is fractured or distorted in some way. And so this describes their thinking. Disorganized thinking also includes delusions, which are false beliefs that people have about the world. For example, if you thought that you were the Queen of England, that would be considered a delusion. And with disorganized thinking also comes disorganized speech, which is typically referred to as word salad. And this term is usually used to describe the jumble of words and ideas that can sometimes be present in schizophrenia. So that's disorganized thinking. Let us move on to hallucinations. And just like with disorganized thinking, how we were talking about distorted thinking, hallucinations are distorted perceptions. And when we talk about perceptions, we're talking about how we interpret the sense information that is coming into our brain. So people with distorted perceptions might taste or feel or see or smell things that are not really there. But many times, especially when we talk about schizophrenia, the hallucinations can sometimes be auditory. And while sometimes these auditory perceptions can just be different sounds, they can also take the form of different voices, who might say inappropriate things or try to give inappropriate orders. And sometimes the things that these voices suggest can really be terrible. Things like telling people to burn themselves with a lighter, or that they have sinned and are flawed in some way. And when we talk about emotional responses that are associated with schizophrenia, we are talking about responses or behaviors that are incredibly inappropriate. And this can include laughing when you find out that someone has gotten seriously injured or even that someone died, or crying or becoming incredibly angry for no apparent reason. Sometimes individuals with schizophrenia will display what's called a flat affect, which is basically showing absolutely no emotional responses at all. Included in this are also compulsive acts. Things like pacing or rocking back and forth, or maybe compulsively rubbing their arms. Some individuals also display what's referred to as catatonia, and this refers to not moving. So things like sitting or standing motionless for hours at a time. And I want to point out something that maybe you've noticed before as I've gone through this list, which is that some of them appear to be in direct conflict with each other. For example, inappropriate actions and flat affect are kind of the opposite things. One is acting out and the other is not responding at all. And we see the same thing here. We have acts like rocking back and forth that people just can't seem to stop. And at the same time, some people also sit motionless for hours. And that's just something that's really interesting to keep in mind as you're trying to figure out exactly what schizophrenia is.